Today, we're going to talk about influenza vaccination during the COVID-19 pandemic. This is Dr. Sharma, your friendly neighborhood medical director and attending physician. Who should get their flu vaccine during the COVID-19 pandemic? The annual flu vaccination is recommended for everyone over age 6 months, with very rare exceptions because it effectively decreases flu illnesses, hospitalizations, and deaths. During this pandemic of COVID-19, reducing the overall burden of respiratory illness in our community is very important to protect not only our vulnerable populations, but also the healthcare system and critical infrastructure. Let's jump into the myths. I always get sick after the flu shot. It is biologically impossible to get the influenza infection via the flu shot. The flu shot does not protect against other non-influenza viruses, and it's possible to get the flu after vaccination. Anyone infected before or just after getting a vaccine can still get the flu. And circulating flu strains are not always exactly like the vaccine. The vaccine is not 100% effective, but it's all still going to reduce the severity of infection. If you're going to get sick, you're going to get sick less. I never get the flu. Not true. Influenza affects 5 to 20% of the US population each year, including healthcare workers. Healthcare workers who work with sick patients means additional work and personal responsibility for others. And keep this in mind, most patients who died from the flu never had it before. The flu is brought in by human vectors. We transmit it. Therefore, if our patients get it, it's most likely because we as healthcare workers bring it to them. I don't want toxins injected into me. Thimerosal is used as a preservative to prevent contamination, but this has been removed from single-dose vaccines and has a minimal dose in multi-dose vials. People think about formaldehyde. There are only trace amounts present during the manufacturing process, and importantly, a pear actually contains much more than a flu shot. So you should be more afraid of pears than your flu shot. I'm allergic to egg. A study of 513 patients with severe egg allergies found no cases of anaphylaxis after vaccination. So if someone has an egg allergy, they can talk to their physician and get an inactivated vaccine. They can get a recombinant vaccine. There are choices, and it's safe. Contraindications. If someone has had a very severe allergic reaction, they should not get the flu mist. And they should definitely discuss it with their physician. But most people who feel that they had a reaction actually had a very common reaction: pain in the arm, mild fever, some fatigue. These are not contraindications to future vaccination. Precautions. People talk about Guillain-Barré syndrome and are fearful of getting that. Well, let's look at the data. The risk of Guillain-Barré following an influenza vaccine is 1 per 1 million doses. But following infection is 17 per 1 million infections. So you can do the math as to how much more likely you are to get Guillain-Barré following influenza infection as compared to a vaccination. Influenza vaccination of healthcare workers and influenza infection among patients. We can stop flu in our patients effectively. If we get staff in our facilities to get the flu vaccine, we can reduce the number of cases of flu that come into our patients, and we can save lives. We can make a difference, but we have to do it. It's as simple as that. All right. Can I have flu and COVID-19 at the same time? Yes. This is called the twindemic. You may have heard about this. It is possible to have flu as well as other respiratory illnesses and COVID-19 at the same time. I'm trying to figure out how common this is. But you can imagine how much worse it would be. It could potentially be deadly. Why take a risk? Let's get rid of at least one element of it. The other problem is that a lot of the symptoms of flu and COVID-19 are the same, and making it hard to tell the difference between symptoms alone. Will a flu vaccine protect me against COVID-19? Getting a flu vaccine will not protect against COVID-19, but flu vaccine will prevent flu. They can reduce the risk of flu illness, hospitalization, and death. Now it's more important than ever. You don't want to have to go to the hospital. You don't want to be sick with flu and be vulnerable to getting other illnesses, including COVID. Does a flu vaccination increase your risk of getting COVID-19? No, not at all. There is no evidence that getting a flu vaccination increases your risk of getting sick from coronavirus like COVID-19. If COVID-19 is spreading in my community, should I still go out and get a flu vaccine? Yes. Getting a flu vaccine is an essential part of protecting your health, your patient's health, and your family's health this season. Should a flu vaccine be given to someone with confirmed COVID-19? Not yet. So for anyone who has either suspected or confirmed COVID-19, until they've met criteria to discontinue isolation, they should wait on getting the flu vaccine. The moment they're cleared, get the vaccine. If they're mildly ill, it's not a contraindication to flu vaccine, but we're trying to keep those people from exposing others who are getting their flu shots at the time of vaccination. So keep calm, get your flu shot. Questions? Let me know. Learn more, go to the cdc.gov, read more about COVID-19 and influenza, and more importantly, be part of the solution, not the problem. Stay safe.